masculinity now, normal, traditional masculine traits of aggression, drive, striving, providing protectiveness, which is so innate, has just been classed as tyrannical, and
it's been vilified. It's been,
it's been vilified.
it's been like we celebrate women who are nurturing because that's their nature. Women have higher, and I can explain it from a medical point of view. Women have higher estrogen levels, higher prolactin, higher oxytocin in the brain centers that light up whenever they touch a baby. Pheromones. There's all sorts of MRI research about this. Women have higher levels of this, and men have higher levels of testosterone. So, in fact, 17 times higher levels. So an average man compared to a woman of the same age, this then decreases when a man hits, is mid-50s and a woman's test level increases, estrogen level increases. But this goes back to the main point, Jason. As a doctor, I learned all about HRT, all about it. I had to go to HRT clinics, hormone replacement therapy, giving women estrogen and progesterone and pessaries and gels and all these kind of counseling sessions. And that's about the menopause. When it comes to the andropause and men's natural test levels plateauing in their mid to late 30s and then decreasing slowly in their 40s, it's not even talked about. So I always used to ask guys in my clinic, are you happy, horny, and hungry? Three things. Are you happy, horny, and hungry? Can you still get your early morning erections? Have you still got an appetite? Do you still have libido? And are you happy? And a lot of men weren't getting them, or kind of all three things. And then GPs would then just prescribe sertraline just for the mood. They'd prescribe psychotherapy for anxiety because you can't get erections. But in the crux of the matter was the underlying thing was a low test level, which wasn't picked up by the GP. But now it's getting some traction at least, and the stuff you do with Man Clinic, I'm really, really grateful for that because it's a higher risk. Men have higher risk of osteopenia, osteomalacia when their test levels decrease, higher rates of suicide and depression when test levels decrease. And it's actually not a midlife crisis, so to speak. It's actually just a lower test level from the andropause. And we don't recognize that. We just talk about the menopause.
Yeah, well, there's little appreciation, isn't there, of how a man changes through life.
Yeah.
And there's been little appreciation, or there was little appreciation for the same for a woman as well. But there's now, rightly so, much more understanding around the menopause, and lots of kind of brands out there who are kind of digging into that area, and it's now more understood, and therefore businesses and people are putting policies in place really to to make sure that's kind of factored into how they're working with women. But you're right, there's no conversation there around men really, and there's no real understanding. It is really just kind of the whole kind of suck it up thing, and it's